Welcome to the Deep Dive. Today, we're tackling something nearly everyone bumps up against eventually.
Low back pain.
It's incredibly common, yeah. We're talking up to, 85% of adults experiencing it.
Exactly. And the cost is just huge, over $86 billion a year in direct medical spending alone.
Staggering, really.
So our mission today is to kind of unpack medical imaging for low back pain. When do you actually need it? Which type?
We want to give you a bit of a shortcut to being well-informed, maybe bust a few myths along the way.
Okay, let's dive right in. Low back pain hits. It's so common. You think, well, step one is get an image, right? An X-ray, an MRI, see what's going on.
That's definitely the common assumption.
Yeah.
But here's the surprising part. For the vast majority, maybe 95% of acute low back pain cases, it's actually self-limiting.
Self-limiting, meaning it just gets better on its own.
Pretty much. Often it's just a simple muscle or ligament strain. It tends to improve quite a bit within weeks, usually with just, conservative care.
So the official guidelines, they strongly recommend starting with a really focused history and a physical exam, not imaging.
Okay, that's definitely counterintuitive for a lot of people. Why not just get the picture, rule things out?
Right. Well, it gets really interesting here. Study after study shows that for these uncomplicated cases, getting imaging early on doesn't actually improve how well you recover.
It doesn't help you get better faster.
Yep. And it can actually lead to other problems. Unnecessary costs, obviously, but also interventions you might not need.
How so?
A big reason is something called incidental findings. Basically, seeing things on the scan that aren't causing your pain.
Like what sort of things?
Oh, common stuff. Disc bulges, bit of degeneration,
Yeah.
things that show up on MRIs in, anywhere from 20 to 80% of adults who have no back pain at all.
80%? Wow.
Yeah. So imagine you have back pain, you get an MRI, you see a bulge. It's natural to think, that's it.
Right, makes sense.
But it might have nothing to do with your current pain. It can cause a lot of unnecessary worry for you, and it might steer treatment down paths that aren't actually helpful, maybe even more invasive ones.
Okay, so for most run-of-the-mill back pain, hold off on the scans, focus on the exam, but clearly imaging is important sometimes. When is it crucial? What are those red flags you mentioned?
Exactly. Imaging becomes absolutely vital when there's a suspicion of something more serious lurking underneath. Those are the red flags we look for.
Can you give some examples?
Sure. Think new problems with bladder or bowel control or numbness in the groin and buttock area, what we call saddle anesthesia. That could signal cauda equina syndrome, which is a surgical emergency.
Oh, serious stuff.
Definitely. Or if someone has a history of cancer, unexplained weight loss, a fever, or is immunosuppressed.
Both.
You worry about infection or cancer spreading to the spine. Significant trauma is another one. Or in patients who have osteoporosis or have been on chronic steroids, you'd be concerned about a possible vertebral compression fracture. Then imaging is needed right away.
What about pain that just hangs around?
Good point. For pain that becomes subacute or chronic, meaning it lasts beyond, say, 4 to 12 weeks, and hasn't improved after about 6 weeks of good conservative treatment, and if you might be a candidate for surgery or an injection, then yes, imaging becomes appropriate to figure out the next steps.
All right, so if imaging is needed, what are the main tools? You hear MRI a lot.
MRI is often the preferred choice when imaging is indicated, yeah. It's excellent for looking at soft tissues, the spinal cord itself, the nerve roots coming off it, the discs.
So that's where you see things like a herniated disc.
Precisely. Especially significant herniations like extrusions.
Yeah.
Also great for spinal stenosis, that's narrowing of the spinal canal. And for spotting infections or metastases, cancer spread. Big advantage, no radiation.
Okay. What about CT scans then?
CT scans are the winners for looking at bone detail. So perfect for assessing fractures or other changes in the vertebrae. They're generally faster than MRI, maybe more available in some places. But the downside is the radiation exposure. It's significant.
And the basic X-ray. Still used.
Plain X-rays, yeah. They're simple, low cost, good for a general overview of spinal alignment, looking for really obvious bony problems. They don't show much detail for acute pain without red flags, but they are useful if you suspect a fracture, particularly in older folks or those with osteoporosis.
Are there other more specialized scans?
There are. Things like bone scans can show areas of increased metabolic activity useful for finding hidden fractures, infections, or tumors. Angiography looks specifically at blood vessels, but these are really reserved for very specific situations where the standard scans haven't quite cracked the case.
This deep dive really hammers home that knowing when not to image seems just as critical as knowing when you should.
Absolutely. It's all about using these powerful tools wisely. For low back pain, the power is in precise application, guided by your symptoms and exam, not just ordering one routinely.
So the bottom line.
While imaging technology is amazing, for low back pain, its effectiveness is really tied to using it at the right time, for the right reasons, based on your individual clinical picture.
And for you, listening, understanding these points really empowers you. It means you can have a much better, more informed discussion with your doctor and advocate for care that's truly evidence-based and right for your specific situation.